Many Americans rang in the new year with hopes for a brighter new year, and of course, a new round of resolutions tends to follow. Well, this morning, we are joined by experts with tips to improve your finances and your physical and mental health in the year to come. And of course, after a year that was dominated by the coronavirus, many people are reflecting on the importance of their health and wellness for 2021. And with vaccines on the way, there's at least one reason to be optimistic. CBS News senior medical correspondent Dr. Narula joins us now. Tara, good morning to you. Happy New Year. I want to begin with a kind of perplexing number from the CDC. Apparently, 4 in 10 Americans delayed or avoided the doctor in 2021. What does that mean for doctor visits in the year to come? And what should we be asking our doctor as we show up again for maybe the first time in a year?
Well, good morning and Happy New Year to you. And you said it, Tony. So many Americans missed those important medical visits this past year. And so now is a great time to circle back with your primary care provider. I like to call them the quarterback of the team, and really have a discussion about what important tests, particularly screening tests, things like mammograms and colonoscopies, you need to catch up with. Also, you want to talk about vaccinations and what you might be behind on. And it's a great time to have a discussion with your primary about any questions you have about the COVID vaccine. Certainly patients who have any chronic medical conditions, so cardiovascular disease, kidney disease, diabetes, you need to be in touch with your specialists who are managing you to make sure that you are on top of those conditions. I like to say that it's also a good time to take a medication inventory. So many people end up on medications. They're not sure why they're on them. They may be interacting with other drugs they're taking. So have a conversation with your primary about everything you're on and what you really need to be on. And finally, I'm a cardiologist, so I have to put in a plug for cardiovascular disease, and knowing your numbers and risk factors. It's still the leading cause of death of both men and women in this country.
Well, we mentioned resolutions at the top, and I think this is related to heart health. Weight loss, that is a very common resolution, and people have had some struggles in 2020, myself included, because gyms were closed in many cases for at least portions of the year. So what do people do in 2021 to get back on the treadmill, so to speak?
It's so true. And almost every single one of my patients has told me that they've really taken a nosedive when it comes to their nutrition, diet, and exercise. But just because gyms are closed doesn't mean it's an excuse not to be active. You can certainly get outside, whether it's for a run, a walk, a bike. Also, you can do sports that maybe don't require close contact, things like tennis. There's so many fitness apps. You can stream classes. YouTube has dance classes you can do. So there are definitely ways to stay active in your home, and you want to make it, if you can, if you have kids, to a family activity. A lot of our kids are in front of screens all day. You want to make sure that they're getting the recommended 60 minutes of exercise, aerobic exercise daily. And for adults, for cardiovascular health, it's about 150 minutes of aerobic exercise per week that you want to focus on.
That's a good reminder. I'm not sure I was getting that, but I was greatly relieved that I was able to put on this tux with only limited strain before this conversation, so good on me. One final question. I checked the tape, and last year, your New Year's resolution was increased mindfulness. 1 year later, how'd you do?
We did pretty good. I say because it became a whole family resolution. I downloaded an app called Calm, which I love and I now recommend to all my patients. And I learned how to meditate. There's really easy ways to do it. You can do it at your desk in the office, at home at night. So now my husband's doing it. We taught our kids how to do it. So we've stayed on top of it. And it's really been a nice form of centering and grounding during a time that's been so stressful for everyone.
Bravo. Dr. Narula, thank you very much. And Gail, there you have it. Most New Year's resolutions are given up after about 2 weeks, but Dr. Narula made it the whole year, and she had a good one too, mindfulness.
Bravo, Dr. Tara Narula. And I can also suggest Headspace. Calm is good, but so is Headspace. You got some options out there.